So if therapeutic effectiveness really depends on therapeutic alliance, your working relationship with your therapist, the ability to be seen and heard by another human and to share your experience with them, then I don't see AI being able to replace those roles. In addition, like I said, AI still agrees with you. And my mom agrees with me as well. She's not my therapist. So it's I need that clinical expertise if I'm going to therapy to be able to figure out what are my blind spots, what are my unhealthy patterns, what are my healthy patterns, where should I focus, where I should not focus, right? So it's really important to have a human in that loop then. Someone with clinical experience, someone with clinical training. I don't think these chatbots have clinical training. I don't think they go through hours of school, training, seeing actual patients before they become a licensed professional.
Hello, and welcome to Season 3 of Beyond the Couch AI in Psychology. I'm your host, Dr. Ernest Wayde. Now, as always, before we get started, I want to thank the organizations that make this podcast possible. This episode is sponsored by the American Board of Professional Psychology, the National Register of Health Service Psychologists, and my consulting firm, Wade AI. Their support helps us create thoughtful, psychology focused conversations about how AI is shaping our field. Okay, so today's conversation brings a perspective we haven't yet had on the show. Most of our discussions are focused on how psychologists are reacting to AI. But today, we're talking to someone who is actually building these systems, specifically for mental health and human well being. Our guest today is Ms. Zainab Iftikhar, a fifth year PhD candidate in computer science at Brown University, working in human computer interactions. Her research focuses on designing human centered AI systems that support physical, cognitive, and emotional well being. A key part of her work looks at how AI can be integrated into mental health counseling. She studies how people interact with these systems, how they interpret their own data, and how AI can be meaningfully embedded into daily routines, including clinical contexts. She's been recognized with the Paris Canal IAC Graduate Fellowship and featured for her work in integrating AI into human-centered mental health counseling. Zainab, welcome to the show.
Thank you. Thank you for having me here.
I'm really excited to have you here and I'd love to talk about your work. But before we get started on that, I always like to ask, how did you get started on this kind of work? And tell us a little bit about your journey that led through AI and what you're currently doing.
Yeah, I was always interested in mental health, but my background is purely technical. So it was computer science and building systems. And it took me some years to figure out that we can actually build technology for mental health as well. I started working with populations in Pakistan with Dr. Suleiman Shahid at Lahore University of Management Sciences and really understanding, can technology be designed in a way to help college students with their mental health problems? And my work started as using technology to improve mental health, but somewhere along the lines, when ChatGPT and all these models came into being, I started seeing that maybe this technology isn't that great, and maybe it's not about just building these models, but also evaluating them. A lot of my work is with peer supporters, people who use their lived experience to support other people. And one concern that I kept hearing was, well, ChatGPT is such a good therapist, or this AI model is such a good therapist. Clearly, what I do does not have any value anymore. And it made me think, no, there must be something about humans actually helping other humans that is meaningful therapeutically. So a lot of my work has shifted now towards evaluating these models and understanding where do they fall short.
Yeah, that's so interesting that people are experiencing that. Now, I know you come from a human computer interaction rather than a clinical practice background. So, how might HCI help psychologists better understand how people experience AI systems?
Yeah, so a part of it is understanding whether AI should be in such high stakes context that is directly affecting human well being. If it is, how should it behave? And if we figured both of those things out, how should it be built responsibly? Right? So, human computer interaction deals with a lot of how are users interacting with the system. Can we observe some longitudinal patterns that can help us define boundaries for these AI systems and how to design them? For instance, take engagement. HCI deals with engagement a lot, how much a user is interacting with the AI system, how lengthy is the conversation, how intense is the conversation. So HCI really sits at this, it's very interdisciplinary, and we collaborate a lot with psychologists and sociologists and clinical practitioners to understand how are we designing or building these systems. So I like to think of HCI as you have AI where you're just building the model and it's very detached from humans. And then you have psychology, which is very clinical in sense. And then HCI is at the bridge of both of these.
Yeah, I love that definition and that description of the interaction between AI and psychology work. You talked a little bit about should AI be involved in these high stakes environments. Tell us a little bit about what your thinking is on that, especially in terms of some of the things that you've seen and heard with AI and how it interacts with people.
So there's both good and bad. It's accessible at 2 a.m. and you're taking a lot of stigma out because some people do struggle with stigma or being judged. Some people are not even cannot even be completely honest with their therapist because they feel shy. But with an AI, you feel comfortable. So comfort and a lack of judgment is something that we see as big things when people go to AI for therapeutic support. Another thing is that if you're overwhelmed, it can help you make some sense with what's going on. So, using some psycho education techniques like breathing interventions, mindfulness interventions, it's like making you like step out of a spiral if you're in that spiral. But at the same time, it can also make you go deeper into the spiral as well. So, if it's used as a support tool, if it's used to manage something in conjunction with therapy, it can be helpful. So, in my work, we have seen a lot that it's if you design AI to provide single session CBT intervention, which are short term. It stays on the prompt. It tries to help you identify what could be your cognitive distortions, what could be some helpful thoughts. But if it's used as a replacement of a therapist, then it's really harmful because these models are designed to agree with you, to engage with you. And therapy is at times opposite of that. A therapist is going to challenge you. A therapist is going to say, what do you mean when you say that? Or if you have an unhealthy thought about your interpersonal relationships, a therapist might try to challenge that thinking. Whereas an AI might say, oh, yeah, you're right. How could this person do that to you? And so you can really go into the spiral. And that's where it's really harmful. That challenging component.
Yeah, I love that description. We've heard that a few times already about how AI really just is designed to agree with you, right? And so we talked a little bit as well about how some of these systems are just designed to make you come back, right? So talk a little about the risk that you see in how people are engaging with AI and how it could sometimes be helpful, but also the risk associated in terms of how they're engaging with these things.
Yes. So the how is it's very contextual and depends on the person. So some people are you I did this participatory workshops with teenagers and we asked them, do you use AI or any companion models like character AI, replica AI for mental health? And they said no. And then we framed that question and we said, do you use these tools to talk about how your day went and to talk about emotions? And they said yes. So it's very varied and contextual. And a lot of the times a user might be seeking validation. A lot of the times a user might be thinking, am I overreacting to this current situation? Is my Sometimes people use it for advice. I like to think about it as a Reddit of in the AI world because before ChatGPT, people would type a problem and then write Reddit, and then go to Reddit and see has other people encountered this problem and what has some advice been. So we see that a lot, like asking AI for advice, asking how to navigate the situation. So that's one way that I like to think of it. But a lot of it is validation. A lot of it, like I said, is accessibility. If you are feeling overwhelmed at 2 a.m. and you need to vent it out or you need to make sense of what you're feeling, it can also be like a journal. It can be cathartic. You can like type it out and see what's going on. So some people do treat it that way. Some people try to see their blind spots. I use it a lot for my blind spots. So, not for my mental health, but if I am having, for instance, I like to give this example. I was feeling a little uncomfortable every time after breakfast, and I gave it what I've been eating for breakfast. And it said, you've been missing fiber. But so I was knowledgeable enough to take or ignore its advice, which is key. So I know what's going on inside me. I know that this is something that I can tweak. But a lot of time people come with it without that clinical knowledge. So this advice is bad, let's ignore it. This advice is good for me, let's stick to it. And I see it a lot with my work that I do with peer supporters as well, who are trying to build an AI model for therapeutic support. And they would say in their interviews, oh, this advice is just bad, so we're going to ignore it. Oh, AI tried to gaslight me, but the rest looks good. So we'll fix that later. And because they have that clinical knowledge, they have that understanding of how therapy is supposed to work. But a lot of users don't. A variety of reasons why people come to these chatbots.
Yeah, I think that's a really important point in that you have the knowledge and the skills and the abilities to recognize when it's being helpful versus when it's being harmful. And so you can pick and choose what's helpful and leave what's not. So but we know that there's a lot of people who use AI for direct mental health care. I mean, there's research that's been shown that ChatGPT is now considered to be the biggest mental health provider. And so there's so much risk associated with that. I'm wondering in terms of the development side of it, how can these tools be designed or redesigned in a more healthy way to make sure that there's healthy disengagement or real world human connection when they're engaging?
I like the framing of healthy disengagement because, again, that is important for therapeutic support. Like effective therapy wants to get you out of the therapist office. So, when it comes for recommendations or when it comes to designing therapeutic or supportive interventions, I think one thing that we can understand is how can we include therapeutic distance in these interactions, right? So, like I said, when they were designed for a short one-on-one single intervention or brief intervention, the AI could like start with a goal, like what really is the goal of the session, and then kind of following a structured psychoeducation protocol, like using techniques from breathing, using techniques from mindfulness. These are low risk behaviors. Like if I'm engaged, if the AI model asks me to breathe, that's low risk for me. If the AI model asks me to do some mindfulness, that's low risk. Journal, low risk. But if it starts going into the territory of helping you or labeling your interpersonal relationships or giving advice that is high risk, it needs to have this classifier of these are the low risk behaviors that I can advise my users. And then these are the high risk behaviors that I should not be doing that. And then another thing is, which is I think doable, is you have some limits, especially for teenage accounts. So, frequent prompts to engage with parents, with human supporters, with your friends, or periodic check ins. And most importantly, analyzing if the user is coming back to it a lot. It has the data of how lengthy the conversation is, how lengthy one session is, how much the user is coming back. So, it can kind of detect dependence. And modern techniques in AI and NLP can also detect how emotional intense a conversation is as well. So if a user account is repeatedly engaging with intense conversations, overly relying, depending on it, coming back to it a lot more frequent, I think it has the capacity to understand those signals that the user might be over relying on my advice or over depending on my advice.
Yeah, I love what you're describing here because you're really talking about making sure that we have clear guidelines and boundaries for the use of AI applications. From the developer point of view, how can they better draw boundaries between things like wellness tools and the therapeutic function and when the tools are being used appropriately versus when it becomes more maladaptive? How could that actually be implemented to make sure that it's actually having a positive impact?
Yeah, that's a great and very tricky question. I think the first thing that comes to my mind is collaborating with psychologists and trying understanding what does risky conversations look like in text or what does healthy like understanding those signals. And one key part is the collaboration with licensed psychologists, building the models based on that input and then auditing them with those psychologists or with those clinicians. A lot of the data that has gone into the training of these LLMs has been sourced from the internet. So there will be a lot of biases that adapt to Western norms and not from people who are less prolific online. So there's a major issue of the data. If a mental health app is claimed to be even a wellness chatbot, what was the data that it was trained on or fine tuned on? So like really having these audits or these check marks Has the model been actually fine-tuned and a better data than what a vanilla LLM was built on? And then has the model been tested and evaluated with clinicians? There's so much that can be done there, but it is a hard problem to just, I think, fix with more data and more collaboration. We can mitigate it, but I do not assume that we can completely solve it with just more data and more collaboration, but it's the first step.
Yeah, I totally agree. I think there is that collaboration that's required between the developers and the psychologists. So from the psychologist point of view now, right, because everyone has a responsibility here, what can psychologists do to try to make sure that these tools are being used safely by themselves and by their clients if they notice that things aren't going as they should?
Yeah, so we tried to do this in one of our studies that was published last year, and we were trying to prompt the GPT-4 series to align with standards that psychologists follow for cognitive behavioral therapy. And some of the risks that were identified were, so this is why the collaboration was so important, because all three psychologists were reviewing all sessions, unlike other work where a lot of the focus has just been on a user says a message and an AI model respond, and then that's where the evaluation end in a lot of recent work. But these unhealthy patterns exhibit themselves in intense, long conversations. Like a lot of the tragic cases that we've been seeing, the teenager or the young adult was interacting over months with the chatbot. So, first thing is really not just evaluating at the message response level. So, oh, this is a message, this is a response of the AI, is it good enough? The first response might be good enough. It's what happens after when you keep interacting with the session. So, like asking the psychologist to review these lengthy, I know it's time consuming. It took a lot of time for us as well. But even if the psychologist could evaluate a sample of the conversations, lengthy conversations, and then identify patterns. Some of the patterns that we identified were the model using so many personal phrases, which is, I hear you, I understand, I care for you, I'm sorry. And then I can understand how much that hurt you. Oh, my heart hurts. These kind of responses from an AI model. So if a person is already distant from their interpersonal relationships, they're going to distant more because now they've found an entity that does care or hear or at least say these responses. So that was one thing that our collaborators kind of flagged. And that again happened in long, lengthy conversations where the psychologist said, the AI model keeps saying this. And I just wonder what impact would it have on actual users. These were synthetic conversations. No user actually interacted with an AI in my study, but these were synthetic conversations. Another conversation that was flagged was the AI model would kind of lecture a user, like really say, oh, you should do this or you should do that, instead of really collaborating what works for you. So we had another, like there was no user autonomy or very little user autonomy. So that's another risk that our psychologists flagged. So when it comes to your question, what should therapists do? First is like evaluating lengthy conversations and then identifying how these interactions should be designed.
Yeah, so that really sounds like it's really important to evaluate not just the interactions, the individual interactions, but the entire relationship between the user and the AI to see what patterns are coming out and how the relationship is changing over time, right? Because you might start by using it and just using it as a tool, but then over time it becomes something that you begin to depend on, and so it's really important to evaluate that. I love that description of the researcher, psychologist, and developer relationship. Tell us a little bit about how you were able to create that dynamic where you were able to work with psychologists well, because I think it's really important to make sure that technologists, developers, and psychologists are working well to get these results.
Yeah, there's a lot of great work out there that was using computational mechanisms to evaluate AI model, which was great. I wanted a different perspective because I wanted to understand what do psychologists think about this work and both the benefits and the harms, because there is a risk of job replacement. So I wanted to understand really how can it be built to augment peer supporters or augment therapists. And I was able to contact different psychologists, and one psychologist I was really lucky to have. Their name is Sean Ransom. They're the director of. I'm spacing out their organization name, but I will. But they're a director of a CBT center in New Orleans, and they were really interested in this as well. And through their connections, I was able to connect with other psychologists. I'm a researcher myself, so I had that space. And then for developers, I collaborate at Brown with people who are building these chatbots. So I was lucky and I had the opportunity to sit at a center where I could connect with psychologists. And I do work with researchers from the Brown Medical School as well. So a lot of this was just driven by Brown and my advisors network.
Yeah, I love the collaborative team that you've built there. I want to ask you about something that you said. You mentioned that there is job risk associated with some of these tools. You've been working with these tools and with developers and the psychologists. What do you see as the likelihood of job replacement, and what are your thoughts on where AI could support and perhaps replace some work versus where it really shouldn't? Like where should those boundaries clearly be drawn?
Yeah, I think this comes back to how, in terms of clinical sense, right? Job replacements in terms of psychologist. Okay. So, in terms of clinical sense, it comes down to therapeutic alliance. And we've talked about in our work how building a therapeutic alliance with an AI model can not just be harmful, but unethical as well. And does it really mean that building a therapeutic relationship with the AI model not result in more harm, as we've seen in recent cases? So, if therapeutic effectiveness really depends on therapeutic alliance, your working relationship with your therapist, the ability to be seen and heard by another human and to share your experience with them, then I don't see AI being able to replace those roles. In addition, like I said, AI still agrees with you. And my mom agrees with me as well. She's not my therapist. So it's I need that clinical expertise if I'm going to therapy to be able to figure out what are my blind spots, what are my unhealthy patterns, what are my healthy patterns, where should I focus, where I should not focus, right? So it's really important to have a human in that loop then. Someone with clinical experience, someone with clinical training. I don't think these chatbots have clinical training. I don't think they go through hours of school, training, seeing actual patients before they become a licensed professional. Um, so that we have job security there. Where I do see it augmenting or being helpful is again the accessibility part. If my therapist is not available at 2 a.m. and I am having an overwhelming moment, can the tool support me? Can the tool support me between sessions? If I already have some clinical understanding of what is good for me, what is bad for me, can I work with the AI to brainstorm some options, right? If it tells me, if I'm having some anxiety and it tells me at 2 a.m., you should take a walk, I should know that it's risky for me to take a walk at 2 a.m. But really brainstorming other options that I can make a tea, I can do some mindful activities. So really supporting low risk activities. And it does a great job in when it writes empathetically, it can do a great job there. So like really calming one down. So it's really great there. And there's been so much research showing how when comparing an AI response to a human response, just response, not long-term behavior. A lot of people prefer AI response because it's lengthy, it's more validating, and it makes user feel better. If a friend says something to me, I might say, "Oh my God, don't worry, it will get better." But the AI model would say that is such a heavy burden. How are you feeling? It makes sense you're feeling this, right? So it does a really it does a good job in
Mhm.
writing
Very
that
validating and
one-time response.
supportive.
Yes.
Yeah.
So, but does that mean that it just replaced therapists? No, because in long-term interactions, it's becoming really harmful.
Yeah, I love that example in terms of the short-term experience versus the long-term purpose, right, of a therapeutic relationship and the need to challenge, sometimes and to push, right? Sometimes, which, like you said, your mom doesn't necessarily do that, but these are things that therapists and the training and expertise that they go through have that experience to be able to know when to do that and how to do that, which AI doesn't necessarily have, right? I think also really important point that you made is that it's one of the things that we should absolutely think about is that AI can be helpful, and there's those instances when accessibility is really important and AI can be very helpful. From your experience, what have you seen where AI has been used in a really helpful, supportive way to therapists or to psychologists? How does that look when it's done right?
Well, it's done right, and this is something that I experienced myself when I was just testing these models. So I had a persona where I was having anxiety at 2 a.m. I told the model that. And I tried to see, okay, does this model, I might not name the model, but does this AI chatbot make me go deeper into the spiral? Or does it nudge me towards, like I said, low risk healthy behaviors? And the chatbot, I think that was programmed really well. I'm not sure if my prompt did that. I think it was a system prompt, and the company's really making efforts to fix that. It kept moving me towards going to sleep because I told it, like, it's 2 a.m. It kept moving me towards things don't have to be solved now, but you do have to wake up in the morning to go to work. How about we sleep? Or and I then prompted it, I can't sleep because I'm trying to break it. And it said, okay, how about maybe doing something comforting? Maybe like making some tea for yourself or watching a comfort show. Nothing heavy, just a comfort. So it kept moving me and nudging me towards these low risk behaviors because whatever most users who come to these chatbots are not most I said are not in a crisis situation where they have to make a decision now, but they want clarity of their situation, and that's what keeps them engaging with the chatbot longer and longer. Like they keep trying to understand what's going on. But a lot of times, if we're trying to understand what's going on late night, when we're already tired, when we're exhausted from the day, it's not going to be fruitful. That kind of clarity is not going to be beneficial. You might come back to it again the next day to ask more and to like to keep coming back for validation. And if our bodies, I'm not a therapist, but I work a lot in this space, so I have some understanding. But if our body is already tired and the situation we're not in is not urgent and we don't have to make a decision right now, then continuing to talk to the chatbot isn't going to help. Moving to these low risk behaviors where we're able to regulate ourselves and regulate our emotions is more helpful. So, when I think that AI model really did a good job of helping the user regulate their emotions instead of just keeping them engaged. So, a good example can look like that.
Yeah, that's really helpful. Zainab, thank you so much for this really cool insights that you've been sharing with us. How do people contact you if they want to continue the conversation or reach out?
Sure, I have my information on my website, which is Zainab Iftikhar, just my first and last name.com. And over there, you can see my LinkedIn or my email and reach out. I'd love to have a chat.
Awesome. And I always like to ask our experts on the show, what's a tip or recommendation that you can leave us with?
The greatest tip that I would leave the listeners with is using the chatbots for interpersonal relationships makes sense. A lot of us too have interpersonal relationship problems, but relying on the model's advice about your friendships, your relationships, totally relying on it is not such a great idea. It's designed to agree with you. So if you think that the model is agreeing with you, try to give it your friend's perspective and become your friend and see if the model then starts agreeing with your friend. So one tip that I would leave.
Yeah, I love that. I love that tip. Challenge the model, right? Give it some different situations and see that if it agrees with you. In my experience, it agrees with everything that I say, and not everything that I say is right. And I'm always, right in every argument that I've ever been in. And so, I think from that sense that I can trust the model. So, no, I'm just kidding. Obviously, these models are, as you said, designed to agree with us. So we absolutely need to be very careful with it.
If the No one's gonna come back to a model who disagrees with them every day in every interaction. So the agreeableness is what drives engagement.
Yeah, absolutely. But as you said, like it's really important to pay attention to the length of the engagement and how often you keep coming back to it, right? Those are really good signs that we should be paying attention to. Zainab, it's been such a pleasure. I really appreciate it. Please come back and share more of your insights with us as you continue to do more research. It's been such a joy having you on the show.
Likewise, thank you for having me.
Awesome. And for everyone else, if you've enjoyed the show, please subscribe and leave us a review. Feedback is a gift, and we love gifts. We hope that you will join us again soon.